Aloha and welcome to AlohaCare's virtual COVID-19 Town Hall webinar. I'm Paula Arsena, Vice President of External Affairs at AlohaCare, and we thank you for joining us today. Today's webinar is the second of a series that focuses on topics important to Hawaii's health safety net community for addressing the COVID-19 pandemic. Our goal for this series is to provide a forum for actionable information that enables us to together do our part to end the pandemic. We'll start with introductions by AlohaCare's CEO, Françoise Culley-Trotman. Our guests, Mayors Derek Kawakami, Mike Victorino, and Mitch Roth will each make their remarks, followed by a Q&A facilitated by Trish Lachica, AlohaCare's Government and Community Relations Manager. We thank those who submitted questions in advance with their registration. You're also welcome to put your questions in the Q&A box during the webinar. We'll do our best to accommodate questions. However, due to time limitations, we may not be able to get to all of them. Now I'd like to introduce you to Françoise Culley-Trotman, AlohaCare's CEO. Françoise joined AlohaCare as our compliance officer in 2017. Appointed CEO in 2020, Françoise has distinguished herself as a leader who emphasizes a team approach to the COVID-19 pandemic and all the work that we do, focused on engaging members to participate in their healthcare. I'll now hand it over to Françoise for a few comments. Françoise?
Thank you, Paula, and aloha, everyone. I apologize for not being on video, but Zoom is not liking me very much today. We're very pleased to continue our town hall series featuring our neighbor island mayors. We have a very diverse audience joining us today, so I want to wish a warm welcome to our employees, Hawaii's medical providers, our social service providers, and many other community members who share a common goal of improving the health of Hawaii's over 430,000 Medicaid beneficiaries. About 40% of those beneficiaries live on the neighbor island. I joined AlohaCare as a compliance officer and became CEO at the beginning of the pandemic. I've experienced the positive impact of collaboration with peer health plans and many other organizations as we address the needs of our community. Together with these partners, AlohaCare took action in donating thousands of PPE to our providers. We sponsored monthly food distributions, implemented a vaccination campaign featuring incentives for our members, and most recently, requiring vaccinations for all of our staff. We are very hopeful that this series helps to support continued collaboration and meaningful progress as our community recovers. We know that great things happen when we work together. On behalf of our over 79,000 members and 270 employees, thank you all so much for your perseverance and resiliency. A very special thanks to Mayors Kawakami, Victorino, and Mayor Roth for their leadership in addressing this pandemic. We are grateful to have you with us today. And I'll now just hand it back to Paula to go ahead and introduce our special guest. Thank you and welcome again.
Thank you, Françoise. And yes, it's my privilege to introduce our guests today. We have our three neighbor island mayors here for the conversation. Mayor Mike Victorino was elected in 2018, became the 8th mayor of the county of Maui. Prior to becoming mayor, he served on the Hawaii State Board of Education and the Maui County Council and in leadership positions with the Knights of Columbus. Born and raised on the Big Island, Mayor Victorino studied business management and at Hawaii Community College and Hilo College. And Mayor Victorino, we welcome you today and thank you for joining us.
Aloha and mahalo for what you're doing. Thank you very much, Paula. Pleasure to meet all of you. First of all, let me say that Maui County is a very unique county. We're a tri-isle county. Actually, we have 4 islands if you count Kaua'l, but 3 islands that are populated. And so this pandemic has really demonstrated the collaboration and effort of all of our communities to work together, even when we're separated by water or by distance. Since last March, we've had many, many changes in our lives. We had the shutdown, which Derek Kawakami and I were a part of, and We know what it meant to close everything down and start again, what I call start our economies up at a later date. And for that time that we were safer at home and locked down, if you want to use that term, many changes occurred. We had farmers that were having crops that needed to be utilized or plowed under. And immediately we put monies there to make sure we could feed those who had lost their jobs and were having a difficult time getting unemployment and other benefits. We also made sure that we put monies, even before the CARES Act monies arrived, into a fund to make sure that rents and mortgages and utility payments for those displaced workers were able to help and get them some assistance through these challenging times. And as we rolled around and the economy started to reopen back in October of last year, we had really set the pace as far as taking care of our people, whether it was for our children, for our kupuna, or for our everyday working force that needed help. And I'm really thankful for all the organizations like AlohaCare and here at Halimakua and Halimaolo and all of these wonderful nonprofits that also stepped in to assist us in this time of need. Maui Economic Opportunity was our lead in many of these programs, and I want to thank Debbie Kabibi and those that really helped us. But all in all, Maui County was very resilient. No matter what happened, we rose to the occasion, and our executive team, our medical group, really kept us up to date as far as what was happening, when it was happening, and where it was happening. And I'm really thankful for that. It wasn't about me, it was about we, the people. And the people of Maui County, in most parts, really stepped up to the forefront. We were able to make sure that people stayed safe. There was food. Even when our hospitals were taxed, people came out, helped us. We provided over $4 million to our medical community, both in PPEs and other dollar assistance to our healthcare system during the pandemic. I'm proud to say that we stand pretty solid now. Since reopening in October, we've never had to shut down again. We've made adjustments when we had spikes, like what we had a couple of months ago, and back in December and January, February of this year, when we had large numbers, we made changes that were meant to keep people healthy and safe. Our economy is strong, and we are diversifying. And now healthcare and wellness is a big part of our consideration. Our agriculture, we have a large agricultural component called Mahipono, and they're doing wonderful work with lands that were fallow from when HCNS, the final plantation in the state, closed in 2015. It's really important to understand that food security is something that Maui County will continue to work very diligently at. We need to make sure we are resilient in that area. Also, technology and how technology has played a big part of our revitalization of our economy. Whether we're working with Kama'aina the First program, Papa Makiki, and many others, we understand that virtual now is a way of life. It's not something new, but it's something that we can grasp onto and continue to evolve. Our Maui Chamber, our Maui County Federal Credit Unions, all across the board have been assisting small businesses in their recovery. And we stand very strong. So with that being said, we're here now. And what do we expect now? We expect to continue to renovate, to revitalize, and to reestablish and reorganize our economy, to be more diversified. The cornerstone will be the hospitality industry. I don't think anybody will disagree with that. But we have to build pillars around it, pillars that will keep us strong. So when the hospitality industry, if again we have another issue like this or others like we've had in the past, we will continue to thrive and our businesses can survive during this period of time. Finally, I'll close with this. I've been blessed to have a great executive team, like I mentioned earlier, a great medical group that's been with us all the way for these 20 months. And they've given me great advice, great insight, and I'm very thankful for that. It's, when one man says he can do it all, he's not much of a leader. I believe a leader needs to have a lot of good people around him who continuously not only say yes, but give them reasons why and why not, and how we can make sure it works for the people. My whole mantra and my whole concern or my whole focus has been keeping the people of Maui County healthy, safe, and keeping our economy resilient. And I've been able to accomplish a lot of this through the people that have been, one of the nonprofit business groups, other government agencies. I want to thank all of them for their help. We're still not out of the woods. We know there's Delta Plus and other things out there, but I continue to monitor that. But we can continue to reopen. As you see, we are reopening like all the other counties, and now we stand very tall as far as getting things done. So I want to thank my fellow mayors, other government officials that have worked closely over the last 20 months to make this happen. So I'll say enough. Let's turn it over to the other mayors and let them give an overview. Mahalo.
Thank you very much, Mayor Victorino. We appreciate your leadership and your collaboration with all the many community organizations in Maui County. It's my pleasure next to introduce Mayor Mitch Roth, who became Hawaii County Mayor in 2020. Mayor Roth has served as the prosecuting attorney for Hawaii County, a position that he held since 2012. And Mayor Roth has dedicated the past 27 years of his career to the health and safety of Hawaii Island residents. Under his leadership, the Office of the Prosecuting Attorney prosecuted several cold cases, implemented the first restorative justice program in the prosecutor's office nationally, created a sex assault unit with attorneys experienced in such cases, and set up community outreach training. He has a bachelor's degree from the University of Hawaii and a Juris Doctorate from Whittier Law School. We'd like to welcome and thank Mayor Roth for joining us today, who's now going to make his remarks.
Aloha, and thank you for having me here. And it's really a pleasure to be on with all of you and my colleagues, Mayor Kawakami and Mayor Victorino. Mayor Victorino kind of said pretty much what all of us are doing. We're all meeting together. We're working together with our communities, our healthcare providers, our nonprofits on the Big Island. We have some really great nonprofits that we've been working with. Community First comes to mind. There's been a whole bunch of things that have kept us relatively safe. If you look at Hawaii, the state, and each of our counties, we're relatively safe as compared to the rest of the country. We've worked really hard, and as Mayor Victorino says, that's not really necessarily because of the mayors. It's because of the people that we get to represent. I think by and large, the people of the state of Hawaii have done a great job in taking kuleana, making it their responsibility to be safe. I came in during this pandemic. I was a prosecutor, and so I was able to see what was going on in our emergency operations during that time. And there was a lot of great things that were started before me by Mayor Kim and his administrations. A lot of those things we took on, but what we've seen with COVID is it's changing. We're in a different place now than we were in March of last year. And though the numbers are higher, we have different treatments that are available that we did not have available. We didn't have vaccinations available. We now have vaccinations. And, as the state continues to get more and more vaccinated, it gives us opportunities to do things. We looked at COVID kind of maybe a little bit different view. One was, well, I think I'll take this back. I think all of us looked at it as we need to make sure that people are safe, that they're not dying, but we also need to make sure that people are safe in their homes and that they're working and we're able to put food on the tables. And so like the other counties, we worked very hard to make sure that our food bank, who did a wonderful job feeding people, was out there feeding. The different community groups that volunteered to help were able to do so. And we worked very closely with them, and we'll continue to work very closely with our community. Our healthcare workers, I can't say enough great things about the healthcare workers that we've had the opportunity to work with on this island. we not only visited the hospitals, but we visited doctors, nurses, and others in the community that are providing support. And to see what all of them went through was just awe-inspiring, and feel really blessed to work with these people, to get the opportunity to see the kind of people that we have in our county. With every adversity, there's always an equal or greater opportunity. And one of the opportunities for me was just to meet some of these people that day in, day out gave of themselves to make sure that everybody was doing well. Moving forward, I was questioned by the paper the other day, what is your, what's Hawaii County going to do? And I think if you were to ask Mayor Victorino and Mayor Kawakami back in March of last year how long this would last, I don't think any of us would have thought it would have lasted this long. If you were to talk to us in May of this year, as the numbers were coming down before Delta, we probably would have all said, another couple of months and we should be through, with this. Delta has changed a lot of things. The good news is, it came and it's going, and we've been able to deal with that. So moving forward, we're going to take steps that get us back to some normalcy, but at the same time, making sure that we're doing so in a safe manner. So that's what we're looking at on Hawaii County. Again, just want to thank all of you for your role, your responsibilities that you've lived up to make sure that all of us are a safer and healthier, Hawaii state, and for us, Hawaii Island. Mahalo. Thank you.
Thank you, Mayor Roth. We really appreciate all the efforts of you and your team, what you've done so far and what you plan to do in the future. Thank you for joining us today. Next, I'd like to introduce Mayor Derek Kawakami, who was elected to be mayor of Kauai County and Niihau in 2018. Prior to mayor, he served on the Kauai County Council and in the Hawaii House of Representatives. A third-generation Kauai resident, he's a graduate of Kauai High School and Chaminade University, and is a credentialed cooperative director for the National Rural Electric Association in Arlington, Virginia. Mayor Kawakami has a strong record as a community volunteer with organizations such as Kauai Economic Development Board, Kauai Police Activities League, Lihui Business Association, Kauai Island Utility Cooperative, Kiwanis Club, and Catholic Charities Advisory Committee. Mayor Kawakami, thank you for joining us today.
Well, thank you very much, and that's quite an introduction. I'm just an average Joe, and but I really feel a very thankful one to be here today with all of you, and I'm very thankful for people taking time out of their day. I just continue to wake up every morning and, in a sense, understanding like what my mom would tell me, that everything happens for a reason, whether it's good or bad. Everything in life happens for a reason. And so I continue to wake up every day just feeling tremendously blessed to have been placed in a leadership role during some really big challenges. And I feel very honored to be able to serve with the current leadership, such as Mayor Roth, Mayor Victorino, Mayor Blangiardi, our governor, our lieutenant governor, and all public servants, and which includes AlohaCare. 25% of Hawaii's residents are on Medicaid, and people are wondering what is AlohaCare. Well, it's a parachute, right? It helps to keep people safe, especially our vulnerable populations, and that's really just what it boils down to for me. I love helping people through good times, through bad times, and we just stay focused on making sure that we have a balance of fulfilling our services and our duty to our people, but also understanding that sometimes government just needs to be a beacon of hope. That sometimes people just need to have their spirits lifted. Sometimes we just gotta be a shoulder to cry on and just a listening ear. And so I just want to thank everybody for allowing me to be here. And it makes my heart happy. Thank you.
Thank you very much. So we're going to now move into our Q&A with our audience. And so I'm going to hand it over to Trish Lachika, our Community and Government Relations Manager, who's going to facilitate the discussion. Trish.
Aloha, everyone, and thank you again to Mayors Kawakami, Mayor Roth, and Victorino for just joining us today. We're going to go ahead and get started with the Q&A portion. Just a reminder for participants to use the Q&A box to submit your questions, and we'll go through them as time permits. But for the first question, which all of you can take turns answering, we're heading into the holiday season, season we all love, and where visitors come and visit our islands, and we can also anticipate increased family gatherings. So it's just, what are your thoughts and plans as we head into the holiday season? Are there any potential, restrictions that you may be planning for, or announcements that the public should know about? And let's start it off with Mayor Kawakami. I think it would be helpful too if you can remind folks just kind of what's the process involved in coordinating with the governor's office when there's these types of restrictions that are under negotiation. Please go ahead.
Yeah, I think first and foremost, we should remind everybody that it is the holiday season. We're coming into Thanksgiving and Christmas. And I know, a lot of people have took it on the chin and have had to go through some rough times. And as much as we're reminding people that this is a season to remind ourselves how much we should be thankful for a lot of families, it's hard. And, sometimes you just need family. And for the past year and a half and even more, there are many families that have had to separate themselves from each other because maybe they had somebody that had a vulnerable health situation at home. Right now, what we try to do is get a well-informed public. And I think that we've really done a good job. A lot of our people are fully vaccinated, especially our elder and our vulnerable population. Now children are able to get vaccines. And we're telling people to please get together, but be mindful, right, that we do have some safe practices that we should be practicing. And they're relatively minor. I know that wearing masks are not fun, but even if we didn't have vaccines, even if we didn't have treatment, when you're dealing with a respiratory virus, the masks are very effective at preventing you from spreading illness just in case you're sick. And it's just a way of being courteous. As far as travelers coming in, we're telling our visitor industry partners that it just boils down to respect, right? We're dealing with a population that is geographically isolated. At times we feel vulnerable, so some people are on pins and needles, but for the most part, visitors that come in with a level of respect and patience, they do quite well. When I travel to places like North Carolina, I stand out like a sore thumb, but I just try to fit in, right? I remind people, just be cool, be patient. We don't honk horns there in Hawaii, so try not to. But our bigger concern is when we saw the Delta variant, it wasn't really the visitor industry. It was our own people who, of course, were visiting family members or traveling inadvertently and not on purpose, right? But we all get sick at times, and traveling and coming back home, becoming sick, and in some cases, unfortunately getting loved ones and friends sick as well. So we're just reminding people that as you do go and travel, that we're recommending that you, one, consider getting vaccinated, but two, also for everybody, it's always a good practice to get tested when you come back home, and that's really what it's all about.
Hello, Mayor. Mayor Roth, would you like to comment?
Again, I agree completely with what Mayor Kawakami is saying. As people are coming into this holiday season, we just ask that remain cautious. Yeah, most of our society is vaccinated, but we're still having some of this out there. So it's the same rules that we've been saying. Wear your masks. If you're going to be in large groups, try not to be in large groups without a mask. We're excited to have visitors back, and we think that the safety protocols in place should be that way. And what we're looking at on Hawaii Island, and I think all the other islands, is operating our destination management action plans, and kind of going to what Mayor Kawakami was saying is trying to get our tourists and visitors just to be a little bit more pono. That's how important that is. But I think that's about it. Mayor Kawakami pretty much covered it pretty well.
Thank you, Mayor Roth. And Mayor Victorino, did you have any comments, and perhaps is there anything that your office is doing in terms of if there's any anticipation of new emergency proclamations from the governor, or are there ways that you coordinate with the other mayor's offices as well in anticipating any types of restrictions for the upcoming holiday season?
Well, thank you for that question, Trish. Really, we do meet on a regular basis, all the mayors and also all the mayors with the governor, keep abreast of changes that are occurring. And we meet with our health officials. I have a health group that we meet regularly every week, and sometimes, depending on numbers, maybe twice a week, to go over all of what's going on. And they're all saying this, that we have to be mindful. It's coming winter season, and the probability of another surge or another outbreak is possible. And so we have to be mindful of that. However, we want to, and I've had a message of hope that I've been passing on lately, because I really believe hope is something we all need. Once you lose hope, you lose all aspect of life and you give up. And once you give up, then other things go wrong, and it seems like it's insurmountable, and sometimes tragedies occur. So for us, we just come off of the holiday weekend with Halloween, and we had like 9 drive-through events, and people went house to house, went off safely. And it went off really, really well. And people were excited and children were happy. And if I can do that, that's a great plus. I just remind everyone that right now we've eased the restrictions the governor has. We here in Maui County, and I think all the counties, have eased restrictions with the mindset that if things start to climb, case counts, or start to overburden our hospital or our medical facilities, that we will have to take appropriate action at that point in time. None of us have a crystal ball. None of us know what's going to happen tomorrow. None of us know if we're going to be here tomorrow. So with that all being said, I really believe at this point, we can look at a good, enjoyable holiday season, just practicing safe travels for those of our residents who travel to the mainland. Make sure you get tested when you come back. I agree with my colleagues. And most important, get vaccinated. Because if you do get vaccinated, not to say you can't get sick, but the severity is less, hospitalization almost never happens, and death usually doesn't occur. And these are things that are really pivotal. So I want to wish everyone, a good holiday season. Our office is saying, go out and enjoy yourself, but do it respectfully, mindful of what's going on. And again, for visitors, we welcome them back. We had a terrific uptick during July, August, and into early September. And then this pandemic really went out of whack, and we had that big surge. And with the government's message, and many of us said the same thing, now's not the time to come to Hawaii. People stopped coming. But they're coming back now. And so let's be welcoming of them and how we can manage our economy and be diversified, as we've talked about in many cases. Thank you.
Thank you. While you're on, Mayor Victorino, I wanted to ask you, so recently we saw the approval of the Pfizer vaccine for children ages 5 and up. Can you share what the timeline is for Maui County? And I don't know if each of the mayors have different timelines on that, but a lot of young families are anticipating being able to get their children vaccinated.
Well, the first thing I have advised our residents, especially for the children, is to go check with their pediatrician if there's any challenges that they see with their, because anybody who knows your child better is their pediatrician. And so I really recommend that as a first step. Our pediatricians and our partners out there, along with some schools, are ready to give vaccinations starting next week already. And so we're excited about that. You know, the timeline is there. But I want people to be safe. I want people to understand what this Pfizer is. 1/3 the dose that the adults got. It's 2 shots again, but it is something that you should check out because children have, are very resilient, but have vulnerabilities that maybe we adults do not have. And so let's take our time, and I've asked people really in our county to take the time to call their pediatrician, to spend some time with them, to make sure they understand the pluses, minuses, some of the challenges, and some of the drawbacks that may occur, but what are the benefits in the long run? And that's very important, the benefits. I will say this, I have a friend who today is crippled from polio. And he told me the story that when the polio shots first came out back in the 60s, his father waited to give the children the vaccination. He was kind of skeptical. And unfortunately, this man got polio and today walks on crutches. And he said, if my dad had done it earlier, I would have never gotten polio. Here, no there, I always tell, let's look at the consequences. Let's look at the results. And vaccinations have been a real integral part of keeping spread and keeping us healthy. So as parents, just go to your pediatrician, give them a call and find out and really make sure you're doing the right thing for your children.
Hello, Mayor. And for Mayor Roth and Kawakami, is there anything your offices are doing in particular to address there's still some vaccine hesitancy? And as you know, folks on this call, our providers are still struggling to get, the remainder of the population vaccinated. But is there anything specific that your office has taken on as initiatives to increase vaccination rates? And feel free to comment on the vaccinating children as well. Who'd like to start? Go ahead, Mayor Roth.
Okay. So, I think all of us have been doing unique things that really are not in the wheelhouse of county governments to get people to get vaccinated, whether it's going out and offering incentives, finding funding streams, helping set these, testing and vaccination centers up. The key for us is really those partnerships with different nonprofit organizations, with our healthcare providers, and really working together as a community and making this a community issue. It's interesting as we talk about going to the 5-year-olds and up, we know that for some groups, this is going to be a no-brainer. And for others, it's going to be a really difficult choice, whether the parents have been vaccinated or not. And so, Mayor Victorino's recommendation of going to your pediatrician, that's an excellent recommendation. We want to make sure that people have all the right information out there. And so we're partnering with those people that can give the information. And Mayor Kawakami said that as well. It's really important that people have correct information. There's a lot of stuff that's out there, especially on the internet, that it is quite foolish to believe. And so a big part of what we're trying to do is we're trying to make sure that people have the right information. I don't know, Mayor Kawakami, I'll turn it over to you.
Yeah, I think the most resonant point we're all trying to make is go talk to the person that you talk to when your child is not feeling well, or if you have questions about their health, which is your pediatrician. Here on Kauai, right out of the gate, got a call from Hawaii Pacific Health at Wilcox Memorial Hospital that on day one, all of their appointments were booked until November 13th. And so they were on the phone with our state hospital system saying that if you folks can open up your Keiki clinic sooner rather than later, please open it up, because there's a large amount of parents out there that are wanting to get their kids vaccinated. What we anticipate is to have the initial surge, because obviously those parents have had the conversations beforehand and they had made their minds up that it is the best path forward for their families and for their children. And then we expect to see, like everything else, a big slowdown where you're going to see some parents that are on the fence trying to get more information. And then, of course, there's going to be some parents that have just made their minds up. We're going to continue to focus on the parents that are on the fence, to have them go out there and talk to their pediatrician, go talk to a number of pediatricians, and then to make sure that they're basing their decisions on a reliable source of information. Right now with the internet and with social media, it's a tool, but it's a double-edged sword, though. Every tool can be used to be very constructive, like a hammer can build things, but a hammer can also be used to pull things apart. And what we've seen is, through social media and with this increased amount of information floating around, it's harder and harder for people to get verifiable and reliable sources of information. And it's really counterproductive and it's really disheartening, but we continue to just try to be a voice of reason. We don't want to push too hard, because when government pushes, it pushes people away as well. So we tell them, hey, go talk to your family members, go talk to somebody else. Unfortunately, out of the gate, and it's nothing to do with here at home, but from the very top and just all around, this pandemic and this virus was politicized right out of the gates, caused confusion and mistrust. And if there's anything that we've learned is, sometimes less is more, especially from elected officials. Sometimes we need to step on the side and let the experts have the biggest voice in the room. And, I think next go around, I hope that we learn from our mistakes. But in general, it's very optimistic out of the gates. We're hoping to get some of those parents that are on the fence and have them make well-informed decisions for their children.
Hello, Mayor Kawakami. So starting with you, I wanted to ask this question that came in our Q&A box. So the legislative session is also coming up. If there's one recommendation that you can make or ask to Governor Ige during your county's economic recovery, what would that be? So starting with you, Mayor Kawakami, and then Mayor Roth and Mayor Victorino.
I come from the grocery business, right? Our family had owned and operated Big Save grocery stores. I'm really not supposed to be a mayor. I'm supposed to be working in a grocery business, which is very much like being a mayor, because we're out there to serve people and we're out there to fill a need. And so I feel like the two jive. The biggest thing I would say is that government has to be mindful that we equip our business owners and our people with information and the tools to make independent decisions, whether it's their health needs or their business needs. The best path forward is to give our people the tools to make well-informed decisions. At this point in time, our business community is well-versed with knowing what it is that they need to do to operate and not have to shut down. Now, we have to be mindful that we don't have a robust workforce available. So these business owners are doing everything and beyond to making sure that, one, they don't have an outbreak in their place of business, because they just cannot afford to have 3 or 4 workers get sick. And I just would ask the legislature and the governor that at some point in time, to really allow businesses to make those well-informed decisions. At this point, I do feel our businesses are well-equipped with good information. They know they can reach out to us to help them build programs around health and safety. And I would just say that, it's been tough. It's been tough. We've really shut down the visitor industry at the front end. The road to recovery is going to be long and hard, and it's going to be a lengthy process. And so as much as we can avoid intervening too much, sometimes, like I said, less is more. That would be my advice to the legislature and to the governors, to allow businesses to recover.
So, I have something kind of similar, but I'm going to say it in a little bit different manner. I think one of the frustrating things for our businesses to allow them to really succeed is having information in a timely manner. We do have a plan that the state has. We need to be, if we're going to be opening up, then we need to give that, the business community time to do what they do best. Give those announcements. This is where we're moving in the next couple of weeks. Oftentimes it's felt like, because things have been thrown at us, like Delta, and we were ready to open up, and then all of a sudden Delta just shot up like a skyrocket. And so we had to, slam the brakes on everything. But as it's coming down, we know that things are coming, and we need to give our business community that time, that notice, and that certainty. When X happens, Y happens. And we're getting close to this. This is where we're going to be moving in the next, hopefully, couple of weeks. So it's that information. It's very similar to what Mayor Kawakami is saying. It's just putting it in a different spin on that.
And I'll close Trish with this. This is just not a problem for our state. This is a worldwide problem. The supply chains are tied up all over the place. We see it on the TV. We see all these major ports. I have a customer or a constituent who is just telling me he has 2 containers stuck in LA for the last 3 weeks. He had to pay, he usually paid $8,000 per container to ship. He paid well over $20,000 per container. These are the things that really hurt, all of our plans. Doesn't make a dent if they can't get the supplies here, and the costs are so prohibitive, and it's going to be passed on to you, the consumer. So what government needs to start stepping in and saying is, how can we help them? Information, giving them the chance to make the right decisions are important. Preparing for the future is also important. But where we can step in is workforce development, getting people ready for the new jobs. I think the other side of it, what kind of breaks can we give them during this period of uncertainty so that they can begin to not only survive, but thrive? And as they thrive, guess what? We in county government and state have the same residual effect. So it amounts to what we see around us in the world, in the state, in the nation, in the state, and our counties. So I am very optimistic. We have really set the tone. The challenge is we know we don't have the workforce. And again, Derek mentioned that as far as the robust workforce. But most importantly, and I'm sorry, I didn't turn my phone off. I apologize. I thought I had turned it off, but I didn't. But really, to conclude is this. We all got to continue working together, really, really, really working together to make things better and to help our businesses in every way possible to enable them to survive and eventually thrive. And that's been what we've been doing here in Maui County since the beginning. And I tell you what, thank God for the CARES Act, for the ARP money, and other monies that have made it possible.
Thank you so much to the three of you. We're just so grateful that you joined us. I know you're so busy. At this point, I'm going to turn it back over to Paula as we conclude our webinar.
Yeah, thank you very much, Trish. And thank you so much to our three mayors today. We really appreciate your spending the time with us. And thank you to our audience. We hope you found that today's webinar was informative and answered your questions. We look forward to your participation in our next installment. And thank you so much, everyone. Aloha and stay safe.
Aloha and mahalo.
Hello, everybody. Thank you so much for all you do and to our community for all they do.